5 Secrets to a Snow White Smile. Teeth are not naturally white, but their color can be improved if you know some secrets. We will tell you which ones. 1. Hygiene. Plaque is constantly formed on the teeth, a sticky film consisting of saliva, bacteria, and dead mucosal cells. Initially, the coating is colorless, but during the day it is stained with food pigments. As a result, the teeth darken. To lighten them, it is enough to clean them well. Whitening pastes, which contain a large number of abrasives, small solid particles, cope with this task more effectively. But they cannot be used for a long time, because with frequent use they damage the enamel of the teeth. With insufficient home hygiene, plaque hardens, actually accreting to the tooth enamel. In this case, brushing with a toothbrush no longer saves you. To brighten your teeth, you need to seek help from a dentist. It will remove hardened deposits with an ultrasonic instrument, and the teeth will become a couple of shades whiter. Important: neither home nor professional hygiene will help to lighten teeth if their staining is due to internal factors. For example, if the teeth are yellowish by nature, their enamel has worn off with age, or the color of the teeth has changed as a result of medication. 2. White diet. With frequent use of coffee, tea, and wine, coloring pigments are deeply eaten into the surface layers of the tooth, affecting their color from the inside. In this case, hygiene also does not give a noticeable result. To preserve the natural shade of teeth, experts recommend minimizing the use of coloring products. 3. Home whitening. Home whitening products include a variety of sticks, strips, and gels that can be purchased over the counter at drugstores or beauty stores. Just like professional products, they contain hydrogen peroxide or carbamide peroxide as bleaching agents. On the teeth, peroxides break down into oxygen, which penetrates the tooth tissues and discolors the yellow pigments. As a result, the teeth become several shades lighter. The whitening course usually includes 10 to 14 procedures. However, you should not expect the Hollywood smile effect from home remedies, since the concentration of peroxide in them is 5 to 10 times lower than in professional whitening systems. On the one hand, this makes them as safe as possible. It is almost impossible for them to burn the mucous membrane, even if they are used incorrectly. But on the other hand, they can whiten their teeth by a maximum of 3 to 4 shades. So, if your teeth are not very yellow, you may not notice many results. 4. Professional whitening. Professional systems are distinguished by the fact that they contain very high concentrations of peroxide, up to 40%. It is not safe to use them on your own, so the procedure is carried out only in the dentist's office. To speed up the breakdown of peroxides, the doctor additionally acts on them with light, photobleaching, or adds chemical activators to the solution, chemical bleaching. This allows you to whiten your teeth in just one visit. During whitening, the dentist follows certain protocols. The oral mucosa is carefully isolated from the whitening solution, and before and after the procedure, the enamel is strengthened with special preparations. You can lighten your teeth by 6 to 10 shades. The result usually lasts for 2 to 3 years, provided that the patient does not smoke or eat a lot of staining food. Over time, the teeth darken again, but in general, their shade remains lighter than it was before whitening. Whitening is not performed for patients under 18 years of age, with caries or erosion of the enamel. There are also relative contraindications. For example, pregnancy or the presence of fillings on the front teeth. Fillings, unlike dental tissues, do not lighten, but after the procedure, they can be replaced with new ones. 5. Veneers. This is an option for those whose teeth do not take professional whitening. For example, teeth of gray shades or stained with a drug, tetracycline, are poorly whitened. Also, veneers can be recommended for patients who smoke or who are not ready to follow a white diet after bleaching. Veneers are ceramic plates that are bonded to the front surface of the teeth. They cover the front and side surfaces of the teeth. The patient chooses the color of the plates himself, based on his aesthetic preferences. Each veneer is made individually by a dental technician, based on casts taken from the patient's teeth. The advantage of veneers is that they do not stain with food dyes. Disadvantage: they require tooth treatment. For the plate to sit beautifully and not disturb the bite, the tooth enamel is ground down to its thickness. The layer of tissues to be removed is insignificant, only 0.5 to 0.7 millimeters. But in the future, it will no longer be possible to remove the veneers. They can only be replaced with new ones. The average lifespan of ceramic veneers is about 15 years. The plates are not installed with enamel defects, bruxism, and the absence of chewing teeth.